Okay, hello guys, welcome back to another video. So we have journeyed together through antenatal clinic and now you are almost delivering or you are almost giving birth. Do you know what you are supposed to pack in that delivery bag? Do you always know what you need to know? Because it's always good to have birth plan, or it's always good to plan things you will need after delivery, because in the hospital we don't always have everything in the hospital. In fact, most of all these public hospital, there is shortage of a lot of things, and therefore you will need to pack even extra. Even if you will get them there, you will need to pack some of the things that you will need in your delivery bag. So number one thing that you're supposed to have is transport that will take you to where you are going to deliver, or where you will deliver to that hospital. You are supposed to have enough transport and extra money in case there is a complication. Maybe if you need to go to the theater, maybe they can send you some of the things like catheter. Some hospital, when you want to deliver, is when you are told to go and buy a catheter. Some even buy those anesthetic drugs and other things. So you need to have transport and extra money in case of anything. The second thing that you are supposed to have in mind, or you're supposed to have in plan, is next of kin. Somebody, when maybe things doesn't go well, they can contact, they can talk to, they can inquire information from. Yeah, you're supposed to have next of kin. That one may be your sister, your husband, or your partner, or the owner of that pregnancy especially. Yeah. The next thing now that you are supposed to have in that delivery bag now is the basic need. Your basic need, the pads, the clothes you will change after delivery. Some hospital, after delivery, they don't give you hospital clothes. So maybe you need some extra clothes that you will change after delivery. In fact, some hospital, they don't have delivery gown, or if they are there, they are few, or you might get even if they are dirty. So you should just prepare yourself. You have some of clothes that you will change in case of anything, in case of that hospital doesn't have enough, or they don't have, or maybe they have been washed and they are not ready. You're supposed to have some of the clothes. You're supposed to have slippers and basin. You're supposed to have a pad or cotton. You can have a pad or cotton. Yeah, those ones you're supposed to have. Those are basic need for yourself that you're supposed to have. Some hospital will want you to go and or you may want you to have your own cup and your plate. They may not have hospital utensils, so you can buy those ones just in case. Yeah, those are some of the things that you can need. Panties. Yeah, panties, if you're not capable of buying that how do you call it, panty pad, I don't know. Yeah, I've said what else you're supposed to have. Yeah, I think those are some of your own basic needs that you are supposed to have. Yeah, now let's go to the newborn equipment that you're supposed to pack in that delivery bag. The first thing that you're supposed to have when you are approaching delivery, you're supposed to buy gloves, because you can deliver on the way. When you are going to hospital, you're supposed to have gloves, a blade or a scissor, and a cord clamp. If you deliver along the way, don't allow people to tie the cord with thread or something dirty. You will the baby will get infection. So you should prepare to have gloves. Those things are not very expensive. If you prepare as early as second trimester or even first trimester, you can start preparing from that far. You buy gloves. you buy cord clamp, you buy scissor or a blade. These things should be new. And also, what else you're supposed to buy for the baby? Yeah, those ones. You're supposed to pack the baby clothes, not one, not two, so many, maybe 10 if you have, or you can pack a few. Yeah, you can just pack a few of the baby clothes. You're supposed to pack some of the clothes, baby blankets, this soft one that they are going to wipe the baby with, because some hospitals they don't have those things, so they will need you to have a clean towel, clean small towel that they can use to wipe the baby after delivery. They are supposed to pack baby blanket. Yeah, you're supposed to pack baby blanket, not one, not two, 3, 4. Yeah, those are some of the things you are supposed to pack for the baby. Another thing that you are supposed to pack is so also there are some of the medical conditions that you might have when you are pregnant, and these maybe you can have diabetes in pregnancy, that we call the gestational diabetes, preeclampsia, or hypertension in pregnancy. You can have anemia in pregnancy. I will talk about them in details. So you're supposed to know signs and symptoms, so make sure you watch all these pregnancy series. Make sure you watch them, because we have a lot to talk about. Today I was just to tell you what you're supposed to know during your antenatal clinic. You're supposed to start your clinic as early as you realized you are pregnant. You are supposed to start your antenatal clinic, because if you don't do that, you will start taking your iron folic acid late, and then your baby might have congenital abnormalities. You might suffer anemia in pregnancy. You might suffer other conditions in pregnancy if you don't start antenatal clinic earlier. So during antenatal clinic, whatever you are expected to do, or the care you are expected to get, I think I've talked about them, about the nutrition, exercise, taking iron folic acid at the right time, and taking them every day, attending your clinic as you have been told. Ensure you know that the danger signs during pregnancy, among other things I've talked about. So thank you for watching this video. Let's meet in another pregnancy series. Bye till next time.